How do we know about how a fetus develops when we can't see it happen? Doctors have equipment that allows them to see inside the human body. You might be familiar with equipment like an X-ray machine that lets doctors look at bones. Like an X-ray machine, an ultrasound machine allows doctors to look inside the body too, but instead of seeing bones, doctors are able to see soft tissue. An ultrasound machine can show live images from inside the body. An ultrasound scan is a medical test that uses sound waves to create an image of the body's soft tissues. Ultrasounds can be used to look at parts of the body like the bladder, kidneys, and abdomen to check glands, make sure organs are healthy, or check for causes of pain. A prenatal ultrasound is when this test is used to check or monitor a pregnancy. Prenatal ultrasounds are safe to do at any stage of pregnancy. It is recommended that at least one ultrasound is performed during a pregnancy, but it's common to have 2 or more. If there are any concerns about the pregnancy, a doctor or midwife may ask for ultrasounds to be performed more often so they have the most up-to-date information to help them make decisions. What typically happens during a prenatal ultrasound? A technician, known as a sonographer, will put gel on the abdomen. This gel helps the sound waves create an image. The technician will place a probe that is connected to a computer into the gel and move it over the abdomen. This probe sends high-frequency sound waves that the computer measures and turns into images. What information can you learn from a prenatal ultrasound? Prenatal ultrasounds can be used to confirm the expected due date, look to see if there is more than one fetus, like in the case of twins or triplets, get information about the growth of the fetus, and to make sure the pregnancy isn't growing outside of the uterus. What you're able to see depends on the type of ultrasound and the gestational duration of the pregnancy, which is a way to say how far along the pregnancy is. Because of their special training, a sonographer is able to look at the ultrasound image and take measurements. The doctor, such as an OB-GYN or radiologist, will review the images to look for signs that the fetus is developing as expected and interpret this information for the patient. A patient without this special training won't know what they're looking at. We've been looking at an ultrasound of an embryo that is about 9 weeks along. At this stage, this embryo is still very small, just about the size of a grape. The part that will develop into the head looks big compared to the rest of the body, which is expected for early development. Looking closely, it may be possible to see the early form of what will become the spine. It can look like a thin, bumpy line going down the back of the embryo. Tiny bumps are starting to show where arms and legs will grow. On the face, the areas where the eyes, nose, and mouth will be are starting to take shape. The part of the body that will develop into either a penis or a vulva and vagina is starting to grow, but it looks similar in all embryos right now. And even though they aren't visible on an ultrasound, tissue that will become the liver, stomach, and kidneys is starting to grow. It's possible to see a flicker in the chest area. This is cardiac activity, indicating that the tissue that will become the heart is developing. Now let's look at an ultrasound from 12 weeks gestation. At 12 weeks, the fetus is still small, about the size of a lime, but more features are visible on the ultrasound image. The head, body, arms, and legs are easier to see and are more developed than earlier. The fetus might move or shift positions, and these small movements can sometimes be seen on screen. The fingers and toes are more clearly shaped. It might be easier to see if a penis or vulva are forming, but it is still difficult to confirm on ultrasound. The heart, while not fully formed or functioning, is beating, and a flickering motion can usually be seen where the heart is located. With special equipment, some of the early shapes of internal organs, like the stomach or bladder, may be seen, depending on the quality of the image. The umbilical cord, which is the connecting structure between the placenta and the fetus, provides nutrients. In most pregnancies, an ultrasound is recommended around 20 weeks. This is called an anatomy scan. During this scan, a healthcare provider looks carefully at the fetus's development, measuring body parts and checking how the organs are growing and working. They may be able to see the brain, heart, spine, stomach, kidneys, bladder, and other structures. This scan can also help identify any concerns or differences in development that might need follow-up or care. Ultrasounds are a helpful medical tool that allow trained professionals to observe the fetus's development at different stages of pregnancy. While some body parts or movements may be visible on screen, understanding what's being seen requires special training and experience. Each pregnancy is unique, and what can be seen on an ultrasound can vary depending on the equipment, the stage of development, and many other factors.